Congratulations again. Well, I think that the point of the family that you also observe is a very, very important point. So, and we have some estimation about the situation of the family concretely, for example, in your country or in your state, is about the sufferings because of the COVID. Do you have some estimation concretely?
I think you might be looking for descriptive data, and I'm not sure what exists there, but with respect to the developmental literature, they're trying to link the experiences of adolescents with their outcomes, and sometimes the experiences are measured crudely, for example, with questionnaires, and sometimes they're measured with observational data, which tends to be better. But what I like about some of the studies, I try to report on the stronger studies, that there were existing longitudinal studies that had data prior to the onset of COVID. And so in that way, it's easier to link kind of causes with effects. So did we see changes in family functioning? Yes. But what's interesting is that we see positive and negative changes. Some families are more stressed. Some families, I think, focused on their need to be a source of support for young people. Some encourage conversations and I mentioned one study that encouraged self-disclosure and so on. And I'm sure in some families, you saw both, right? You see families that are experiencing stress and then also taking the time to sit down and talk. And in other words, most families, we need to think harder, I think, about how to measure both the stresses and the supports within a given family. So it's complicated no matter what no matter what context you're looking at, family, peers, schools, communities, and so on.
There are more questions? Yes, please.
So thank you for that really helpful set of frameworks. And one question I had as I was listening to you talk about how with longitudinal data, you can see that certain family characteristics, whether it's self-disclosure, parental support, really helped mitigate some of the negative effects during the crisis, which then makes me wonder, do we have interventions that we can use in non-crisis time to help families be more resilient for when crises hit? Or is that, it's just, where are we on the kind of our evidence base on building that kind of resilience in families?
Laurie and I found ourselves again and again finding papers discussing self-regulation. So when you're stressed, do you know how to calm yourself down? This is a skill that's important whether you're 2 or 102. So important for adolescents as well as for parents. And I think interventions gained at helping young people with to improve their self-regulation probably have the most hope. And if you're talking about parenting programs, I think the same holds. I mean, this is something I've been studying early childhood my whole life. It's very trying to interact with 2-year-olds, right? And even just helping parents of young children realize sometimes it's good to step away, for example, right? Calm yourself down and then come back. Or helping parents understanding that ignoring bad behavior is actually a very effective thing to do and doesn't even require self-regulation, right? Just ignore. So yes, I think we've learned a lot about child development generally that would help us with the kinds of intervention programs we're talking about. But these kinds of interventions are maybe even more important during something like a pandemic.
Okay, I want to say a compliment of my work. What about the birth of the children in this decrease or not? Because for the family, no, the birth, yes. Yes. Is decrease or not in this time?
Right. I'm not sure the answer to that. Mary, do you know that? It's gone down? Yeah. So,
I have a question, Monsignor.
After James and after Marcelo.
I would like to hear from those of you who know more about early childhood education than I do. I want to ask you a question about our assumption that technology is going to help us resolve all of this, which I feel in the room a little bit. In my field, Google has not been helping us, not at all. We have at least as much of a challenge to combat disinformation and lies about prostitution, sex work, trafficking, as we have an advantage of connecting people with community resources. I was in a meeting a month ago with the Center for World Indigenous Studies, and we were taught, I said, oh, we can use internet communication to support people who are resisting massive resource extraction projects. And they looked at me as if I was from another planet, which I am, really. When you're talking with indigenous people on the ground, one of the things they said to me is 70% of indigenous people do not have internet, are not going to have an iPhone that's worth $600. They're going to sell it as fast as they can to get food for their family and access their survival needs. And same with laptops. What they said is in existence is radio communications, and that's probably not going to go down when the web goes down in the event of a global catastrophe. I found this very, very interesting because I haven't thought about radio as 101 education for many, many years. That's one thing I want to ask you about. The other thing is, I've been up close and personal with grandkids and Zoom education. My family has kept my grandkids away from the computer for many, many years. They're boys. And they've become addicted since the school went online. They are absolutely addicted. There are fights in the family about getting them off at the end of the day, even educational programs. So could you comment on the mixed benefits of online education, please?
In our paper, we talked about the education system in Chile and what happened during the pandemic. In fact, there was no infrastructure to really deliver any kind of education of note. So what they did was mailed lesson plans home for children. They did use television to some extent. So it's interesting that you mentioned that. But there wasn't really online learning, I think, what we're talking about. So, I think what Jeff was trying to say is there some potential for online learning? And there's no doubt that there are some connectivity issues that would have to be dealt with. So, this is a big, huge topic, as you know, Melissa. Mostly what I have been talking about is really something different, right? So it's just psychosocial development rather than learning, but trying to make the point that what happened in schools had an impact on psychosocial development.
So different governments around the world have very different strategies of containment of COVID. Are there differences as a result of those different strategies that affect differentially the psychological outcomes?
Well, I think the length of school closures probably had a big impact, but I didn't see any research on that. Some people think masking is making a difference too, especially for younger children in schools. But again, I'm not aware of any research on that. It's a really good question, though.
Chelo?
Thank you so much, Kathy and Laurie, for your paper. One of the conceptual themes at the core of the research in your field has been the contributions flowing from, let's call it cultural psychology, psychological anthropology. And one of the big binaries that flows from that literature is the binary between cultures where individualism kind of structure identity and the social process, and cultures where the self lives in and with others. In your field, Kathy, Hazel Marcus, there's an entire corpus of literature on that domain. From very, very basic empirical studies, field independence, field dependence. Japanese kids test very differently than kids in Massachusetts. To the work of Carola on the ways culture structure narrative in narrative development. So what do we know about that? What do we know about, broadly speaking, more Confucian, perhaps, oriented societies versus more individualistic oriented societies, and the impact of that general binary in development and children and education?
I mentioned it in this one study conducted, I think it was Sweden. I'll look. But what they had measures of children before the pandemic, and some of them were more, they used a term like more collective oriented. And they definitely found differences post-pandemic. Those who are more collectively oriented were more likely to wear a mask and engage in healthy behaviors. And I thought this was fascinating, more likely to volunteer in their communities. So that's one of the reasons, and there is an American study that's somewhat similar. I don't know that there's any cross-cultural research between culture. So this was the within culture study. I think what you're asking is if you looked between cultures, are the cultures that are more individualistic less likely to engage in healthy behaviors than the cultures that are more collectivistic? It certainly seems like a reasonable hypothesis, right?
Quickly follow up. I actually had a related question or thought. Oh, sorry.